Nations most impacted by COVID-19 face many of the same challenges when it comes to getting protection from the virus. Madeline O'Neill shares how health officials are distributing the vaccine through a lens of equity. Maddie?
Well, from hospitals to public health departments to the state health department, there is a focus on making sure that everyone who wants a shot has an equal shot at getting the vaccine. In many cases, that means using a tool provided by the CDC in times of disaster. From the lost memories of what could have been to the painful new ones.
We've lost over 500,000 people.
Nothing about COVID-19 is fair.
That number keeps me up at night.
For some, the virus has been especially unfair, with minorities more likely to get sick and die.
This is a terrible crisis.
UW-Madison Assistant Professor Tiffany Green points to structural racism, differences in access to health care, factors always lurking, now exposed in broad daylight.
We are seeing a lot of people that want the vaccine and can't get it.
But not just because of supply.
Our focus has been around racial equity.
At UW Health, that's meant sending the first round of 1B vaccine invitations to higher-risk patients 65 and older, including Black, Latinx, and Native American patients. While vaccinating their Phase 1A employees, UW Health used an algorithm taking into account age and the Social Vulnerability Index.
One way to really be able to determine those who are potentially at higher risk.
At higher risk for things like hospitalization and death, taking into account factors such as socioeconomic status, minority status, and transportation access. The SVI shows Rock County at a moderate to high level of vulnerability, the highest in our viewing area. Rock County public health officials see it play out specifically in urban settings like Janesville and Beloit.
Poverty, race, language, disease burden, age, lack of access to transportation and housing are considered in our vaccination efforts.
Once that's identified.
So we're able to specifically target and bring resources into communities without necessarily putting them higher on a list.
That means bringing vaccine information about things like available appointments to neighborhood businesses and leaders.
We're looking at meeting people where they are in their communities where they live.
But it's not a one-way street.
Whatever those barriers that we identify through listening to those communities, we're able to mitigate them.
Now, Janesville is home to Wisconsin's first public regional vaccination site at Black Hawk Technical College.
I think the state has seen the need and that we have in Rock County.
We are making good efforts, particularly with putting vaccine clinics in places like Rock County that rely on community-centered healthcare providers.
Green says the state as a whole can do better, as the pandemic numbers keep her up at night.
It's just staggering.
She's thinking about a more fair tomorrow.
Look at making long-term investments in our public health infrastructure so that when the next pandemic comes, and it will, that we are prepared.
The Wisconsin Department of Health Services has a number of considerations that go into how they distribute the vaccine to vaccinators across the state, including the Social Vulnerability Index. Now, Rock County health officials ask people to be patient while they wait for their vaccine, and in the meantime, keep up with testing, masking, and distancing.